my name is Dr. Alicia.
And I'm Dr. Rachel Diamond, and we're going to talk to you today about running injury prevention and treatment.
So I just wanted to start with a little bit of an introduction about myself. I grew up in Marlborough, Massachusetts, so I'm a local around here, and I started running in high school. I ran cross country, indoor track, and outdoor track, and that's where I started to develop a passion for sports and physical therapy. So I went to UMass Lowell right away with the plan to become a physical therapist. I got my bachelor's in exercise physiology before continuing on to get my doctorate. And then I worked at one clinic for about a year before I came to Physical Metro West, and I've been here for about 2 years now. My last race was actually the Providence Half Marathon early May, but it had to be a virtual race because of COVID-19. And my next race is going to be the Bay State Marathon, which will be my first full marathon.
Hi, I'm Rachel Diamond. I'm actually born and raised in Florida, but we moved up here a few years ago for my husband's job. I grew up playing sports, never really a runner, but after I got into physical therapy, I really started to find something new for me to do, and I really enjoyed running once we moved up here. I've been working at Physical since we moved to Massachusetts about 4 years ago. And my last race was a little while ago, but I did a 10-miler in Newport, and I'm also training for my first marathon in October.
So what we're going to first start talking about is what is good running form. And this is a really good place for us to start out with, because when you come into the clinic, one of the first things that we'll want to get to look at is how you're running. Depending on the injury, you might not get on the treadmill the first day, but it's definitely something that we're concerned about. So the example I wanted to talk to you about was in the picture actually on the left. So this runner, I'm not sure if you know who she is, but it's Desiree Linden. She actually won the Boston Marathon in 2018. And the reason why I really like this photo is because this race was absolutely horrible conditions. It was raining, it was freezing, I'm pretty sure it was even snowing during part of it. And this picture, I believe, was taken towards the end of the race because you can tell it's still raining and there's a lot of volunteers in the picture. So after running like 26 miles, you can see that her form is still very powerful. Her eyes are focused, her shoulders are relaxed, her trunk shifted forward a little bit, which really helps with running economy. Her arms are driving forward and backward in that sagittal plane, and her legs still just look very strong. So there's a lot of things that go into having good running form like that. We'd be looking at range of motion and strength, and especially endurance to be able to carry you that far. So even if you're not running a marathon specifically, those are the kind of things that we're going to want to look at. So now we're going to get into some common causes of pain or injury for what we'll see in the clinic. The big one is overtraining, and I think this is specifically important right now during COVID-19 because we're getting a lot of new runners. So what I tend to find with people who are doing this for the first time is that they think more is better. So you get somebody who wants to run fast like right now, so they'll go on runs every single day, and that's too much for your body. So anytime when you change something too quickly, whether it's intensity, the frequency of your runs, or how long you're running for, this can lead to an injury. The other common cause of injury that we'll talk about is muscle imbalance, and this actually relates a lot to running mechanics. If you don't have enough range of motion in a certain part of your body, and you don't have enough strength to support yourself, that's going to lead to faulty gait mechanics and end up with an injury. Some of the biggest mistakes that we see here in the clinic is, number one, ignoring the pain. We see a lot of runners that just try to train through it because they're really excited about their races, but if there's an issue going on and it's not going away, you really should see someone and get an examination. The other big mistake is skipping the warm-up, and I think a lot of us are guilty about this because we live such a busy life. We go from sitting in the office all day in one position to going on a run. That's a lot of force and load on your joints, tendons, muscles. So it's really important to get about a 10 to 15 minute warm-up before you get started. And the last one I have listed there is something I keep saying during this presentation actually. So it's a theme. Increasing intensity, frequency, or duration during your runs too quickly will lead to an injury. So there has to be some ramp-up period if you want to get faster. So there's actually some tests that you can even do from home to see if there's some issue going on, even if you're not having pain. So we'll go through a few of these and we'll take some videos and then you can try it yourself. The first one we're going to go over is great toe extension. So you can do this one from home. You're going to sit in a chair. I would actually pick something probably a little bit lower than this so that your hips are at 90 degrees, your knees are at 90 degrees, and so is your foot. But what you're going to do is you're going to bend over, and then you're going to pick up your big toe. And what you're looking for is to see if you have at least 30 degrees of extension there. Now, it's kind of hard for me to see because I'm over here. But if you have a nice friend to hold a camera for you, you can get a better look to see what your foot is doing. Now, a couple of things that you want to look at while you're doing this is as you lift your big toe up, make sure that you're not lifting the ball of your foot up as well, because that's cheating. So if you had trouble doing this exercise, or you weren't able to lift your toe up quite enough, or if it was painful for you, you might have some issues with your plantar fascia and might need to work on your mobility a little bit more. We're gonna do a test to see if you have any tightness in your gastroc muscle. So you're gonna start in the same position as that last test. I have a dowel here just as a visual representation for you, but you don't necessarily need it. So you're gonna be sitting in the chair, and what I'm gonna have you do is scooch forward until your knees are going past your toes. If you're not able to do that, or if your heel starts popping up and you can't keep it on the ground, you have some tightness back here and we need to work on it. What we're gonna do is to assess for hip flexor tightness, so that's that area in the front of the hip here. So I have the dowel here. At home you can use a broomstick, or you can line yourself up with a wall. What you're gonna do is you're gonna tuck in your tailbone to do a posterior pelvic tilt to try to get rid of that natural arch in your low back. If this feels really tight, then we need to stretch it. Another test that we'll look at in the clinic is a single leg balance test. There's a lot of things that we'll look at, particularly the foot, and see how the foot accommodates while you're standing on one leg. We look to see if your foot dips in or out to see if there's any issue with stability there. One way to make this a little bit harder is to close your eyes. Another thing that we'll look at while doing the single leg balance test is what's going on at your pelvis. A lot of the times we'll see people who automatically start dropping their hip or leaning their trunk to one side, and that tells us there's a lot of weakness in the glutes. So that's something that we need to work on. So the last one that we're gonna go over is a single leg squat. So standing on one leg, hands on your hips, and then I'm gonna have you come back into a squat. I put a chair behind me for safety, just in case you fall, and it increases your confidence. While you're doing this, I'm looking for a couple of different things. I think I even showed it to you because I've been doing a lot of squats right now. When your knee caves in, that's one thing that we're looking for, and it tells us there's a lot of weakness going on up here. The other things that we look for is your hands coming off your hips, you lose your balance, lose your footing, things like that.
Right, so one of the most common questions that we get is about stretching. It is very important to stretch, but we're going to talk to you about the best ways to stretch, both prior to activity and then after activity. Before you go out on any long run or walk, you should do a warm-up walk or jog. So I would say about 10 minutes, depending on how long you're going to go out for. After you warm up a little bit, then you should do some dynamic stretching and drills. We'll go over those in just a little bit and demonstrate them for you. Then you go on your run or your walk. Afterwards, you do a little bit of a recovery run or jog, and then you finish with your recovery stretches, which is more of those static, prolonged stretches that you typically think about. Those are the ones that we want to save for after the run. All right, so now we're going to show you a dynamic warm-up that you can do before you go out for a run. All right, so we're going to start with some toe walking, just to warm up the calf muscles. And then we're going to do some heel walking. All right, now some toe touches, or as Dr. Alicia likes to call them, zombie kicks. Knees. And butt kicks. I like to throw in some longer strides just to kind of warm up. So right, and the last one is the karaoke. So there are a bunch of really good exercises that you can do to help prevent injury, and today I'm going to go over just a few of them. So we'll demonstrate these in just a few minutes. Like I said, I'm just going to demonstrate a few strengthening exercises that are really important to help prevent injury. Keep in mind that if injury is present, these may change. As I go through, I'll kind of tell you how many you can do at a time and how many sets to do of each one. So first we're gonna do some calf strengthening. I like to use the edge of the stair just so that you can get not only the up part of the exercise, but also the slow lowering down part of the exercise, which is really important when we land while we're running to help kind of absorb the load of that landing. So we're gonna do both calf raises with the knees straight. Nice and slow on the way down. You can do 10 of those at a time. And then you also want to do some with the knees bent because there's two different muscles in your calf and both are really important for different phases of running. Try to aim for 2 to 3 sets of those. Alright, so next I'm going to show you a basic bridge, and I'll show you a couple different ways you can progress this exercises as well. Bridges are really important for strengthening your glutes, which help for the push-off and propulsion during running. So here's your basic bridge. You want to bring your feet in nice and close to you. Keep a little space between your feet as well, and your knees are going to be in line with your hips and your feet. Brace your core in nice and tight, and then squeeze your glutes together as you lift up into a bridge until your body is nice and straight. Hold for about 5 seconds, and then slowly lower back down. A couple different ways to make this harder. You can add a band around your knees, you can put a weight over your hips, or you can come into a single leg bridge and really focus on keeping your pelvis nice and straight as you bridge up and down. Next, I'm going to demonstrate both a regular elbow plank and a side plank. Your core is really important when you're running to provide like a stable base for the power that you want to generate from your arms and your legs. So first is just a regular elbow plank. You want to get down onto your elbows. Make sure, turn to the side a little bit. Make sure that your hands are forward, not turning in, just to help reduce some of the stress at your shoulders. And then you also want to make sure that your back is nice and flat. So you want to start by holding this plank for, maybe 20-30 seconds, and ultimately your goal is to work up to about a minute. Also really focus on keeping your neck nice and straight. You don't want to arch it up and look forward or look down at your knees. Next, you can come up into a side plank. These are really important for not only your core strength, but also your glute strength to help prevent that hip drop that Dr. Alicia was talking about earlier. So just make sure that you're in a nice straight line. Ways to progress this are by adding a kick up and down, and then you can also regress it by putting your bottom knee down and lifting up into a plank this way. Next is just your basic squat. So these are really important for not only the hip strength, which we worked on with some of the other exercises, but also your quads. Your quads and your glutes are really important for also absorbing some of that load when you land while running. So basic squat, you want feet hip width apart. Keep your weight in your heels. You should be able to wiggle your toes. And as you go down, you want to focus on keeping your knees out over your feet. You don't want them to cave in. That's kind of what Dr. Alicia was talking about earlier with the single leg squat. So I'm going to go down into a squat, hold for about 5 seconds or so, and then slowly come back up. From the side as well, make sure you keep your back nice and flat, keep your gaze forward, and then come back up. So some ways to make that a little bit harder too: hold a weight, put a band around your knees, and eventually you can start to practice even single leg squatting over a bench or something like that. So if you notice that you had a little bit of trouble with the balance test that Dr. Alicia showed you, you want to practice there first. So on a flat surface, no other movement or surfaces. So get the hang of that first. Try and work up to 30 seconds to a minute before you make it a little bit harder. Again, you really want to focus on keeping your pelvis nice and level and staying as still as you possibly can. From there, you can start to add like an unstable surface, balancing on a pillow or a piece of foam, or even an incline, which is really good for carryover into running roads that are not always perfectly flat. Okay, so we want to talk to you about a few of the most common running injuries that we see. These injuries we also see crop up in people who are walking a lot for exercise as well. All right, so one of the most common injuries that we see in the hip is gluteal tendinopathy. The glute muscles all kind of wrap around and attach at the outside of your femur bone, and where they attach, they can get irritated and painful if they're not strong enough to accommodate some of the load that is needed during the stance phase of running. We often see with this the diagnosis of like a bursitis or irritated bursa that sits right under those muscles where they attach. And what's really important when you have an injury like this is to focus on certain stretches, strengthening exercises, and possibly even tweak your running form just a little bit. All right, so next is IT band syndrome. You've probably heard of this before. The IT band is a thick kind of fascial structure on the outside of the leg. It goes from the outside of the hip down to the outside of the knee. It can cause pain and discomfort up in the outside of the hip, but that really overlaps with what we were just talking about as far as the glute tendinopathy. So what I really wanted to focus on here was more the pain that occurs at the outside of the knee that can be really common in runners. As we extend our hip, sometimes that IT band can cause compression to the structures underneath it, both at the hip and at the outside of the knee. So what people often experience is almost like a snapping sensation, or almost like kind of like a friction type pain as they're bending their knee during the stance phase of running. So next is patellofemoral syndrome, often referred to as runner's knee. What tends to happen is people start to get pain around the kneecap, either underneath the kneecap, below the kneecap, or anywhere around the sides. Usually this is due to a muscle imbalance, a weakness or tightness in certain muscle groups that make the patella not track perfectly in its groove. We often see this with overtraining or poor running mechanics.
We're going to talk about medial tibial stress syndrome, or as you might know as shin splints. So typically when you have a shin splint, you're going to feel pain pretty diffuse along your leg, along this region here, the posterior medial border of your tibia. And the pain will be related to activity. So you might feel great at the office all day, but when you go to walk to your car or even just going for a run, you'll start to feel the pain. Usually this happens because of an overuse injury. So let's say you go from sitting at the office all day to trying to do like a 7-mile run. That kind of stress might cause some increased strain to this area and lead to an issue. Next, we're going to talk about plantar fasciitis. And now the interesting thing about this condition is it's definitely not just runners who experience this. You probably know a lot of people in your life that complain of foot pain. So with plantar fasciitis, typically the pain will be localized around the bottom of your heel, but sometimes you might feel it in the arch of your foot as well. And the very characteristic sign of this is if you get up in the morning and you're hobbling out of bed and have some sharp pain in your foot, but gets better as you start to walk around. This kind of injury happens when there's some change in your routine. Maybe you changed your shoes. Another thing that might have caused this kind of issue is, let's say you went from a sitting desk to a standing desk all day and you don't have really good shock absorption in the carpet. That can lead to this issue as well. Achilles tendinopathy is one of the most common overuse injuries in runners. And actually about 7 to 9% of runners a year will end up getting this, usually between ages 30 to 50. The biggest complaint with having this is pain with activity. This usually happens while training rather than while running a race. And what happens is there's a pathological change to the tendon due to the excessive stresses from training. So like what we were saying earlier, either too much intensity during your run, you're going too long or too fast.
It's really important to take the time to recover properly. This may mean that you need to either reduce your training load or rest from running altogether. That doesn't mean you have to stop exercising completely. There are many different ways to cross-train so that you can continue to keep your endurance while resting from running. And that's kind of where we come in. As PTs, there's a lot we can do to help you with your injuries. Not only help you to diagnose what's going on, but then also to give you the right tools so that we can get you better and get you back to your training as quickly as possible.
Hey, Dr. Rachel, will running cause arthritis?
So actually, research shows that running does not necessarily cause arthritis. Actually, incorporating some recreational running has been shown to prevent the progression of arthritis and even help to reduce some of the symptoms that are associated with already diagnosed arthritis in the knees.
What shoe should I wear?
So there's not actually any evidence to show that any one type of shoe is best, whether that be a minimalist shoe or a traditional shoe or a maximalist shoe. What's really most important is not changing your type of shoe too quickly. So if you were to go from a very supportive maximalist shoe to a very neutral minimalist shoe, that can lead to injury. We want to make those changes very gradually. And actually, before you change your shoes, it may be that we just need to work on some exercises to help strengthen and stretch areas in the lower body to help with any pain that you may be having. Dr. Alicia, what is the best striking pattern?
So this question's actually kind of interesting because the research on this has changed a lot over the years. Before, we thought that striking mid-foot to forefoot was actually better for your running economy, but now we're finding that this might not be the case. So research is actually showing that it doesn't really matter if you're a heel striker or a forefoot striker, but that actually changing the way that you're striking can actually cause injuries because that other muscles, the joints, are not used to that kind of loading. So how should I run? You should really stick to what feels natural to you, and there's usually other variables about your running that we can change to reduce your risk for injury.
So can I keep training while I'm injured?
This question really depends. Sometimes when you come in and we talk about your injury, we can still keep you on a running program, but more often than not, we'll be reducing your volume. Depending on the severity of your injury, we might have to ask you to stop running for the time being. So really the answer is you should come in and talk to us.